terms of numbers, Manchester and Nashua have borne the brunt of the COVID-19 pandemic in the Granite State. And their respective health departments have been front and center for more than a year now in the battle against this virus. Now, as the state scales back its involvement in the day-to-day response to COVID-19, health departments are keeping up the fight. Here this morning to discuss that are the directors of Manchester and Nashua Health Departments, Bobby Bagley and Anna Thomas. Thank you both for joining us. Now, let's start with you, Bobby. How is the mission regarding COVID-19 evolving now as we see the fixed sites going away?
Good morning, Adam, and thank you for having me this morning. In Nashua, we still will continue our efforts to make sure that we can vaccinate as many individuals that want to be vaccinated. So although the fixed sites will be ending the services that they are providing at the end of this month, we will continue to provide vaccination clinics at pop-up clinics in the community, as well as at some scheduled clinics at sites, for instance, at Elm Street Middle School on Tuesday afternoons. And then we are in the process of moving back into our newly renovated building at 18 Mulberry Street. We will also be able to offer vaccination clinics from that site as well. So we will continue with our efforts of meeting people where they are with scheduled pop-up clinics and with clinics scheduled with businesses as they see the need for their employees to be vaccinated.
Anna, how about in the Queen City? How does this mission evolve now?
Yeah, and also thank you for having me on the show. You know, I think we are sister cities, so we follow each other in each other's footsteps, very much so. So we're also doing a lot of mobile clinics. We have opened up the health department on Mondays and Wednesdays for anybody who wants to walk up without an appointment to get vaccinated. And for those people who need an appointment on a different day, just call our COVID hotline at 668-1547. We're going to continue to go and, outreach into the community, get into the neighborhoods, do these pop-up clinics, these mobile clinics, wherever we can. We're just going to keep going until we reach as many people who want to get a vaccination. So that is our mission right now.
Bobby, what's the biggest obstacle right now to reaching those vaccine-hesitant populations and getting them those shots? Is it apathy? Is it fear? Politics? What's going on?
So for the most part, Adam, I changed that from hesitancy to cautiousness. And so we have had people that have been hearing about the vaccines, the efficacy of these vaccines, and some people still are very cautious because individuals have had some of the expected side effects from getting the vaccine, whether it's the soreness of the arm, the tiredness, some of those flu-like symptoms. And so we do have some folks that have, the cautiousness around those issues. We have others that may be a little bit skeptical, again, because of the history. In our communities, we're really doing an effort to reach our Black, Indigenous, and other people of color population groups. And so some of that longstanding history of systemic racism still plays a role for some of those individuals. But for the most part, we're finding that people want to get vaccinated. And so if we can make vaccine accessible to them by going to the community and meeting people where they are and having conversations with people, we're finding that once they learn and hear from public health and from the medical providers, they will go ahead and get vaccinated. And so for some of them, it's just getting that information to them, not necessarily through some of the means of communication that we always think of, but one-on-one or right directly to that population, we're finding that people will respond and get vaccinated.
And Anna and Bobby will discuss those equity efforts more in just a moment. But Anna, what is the best way, do you think, to get to those populations, the people who are hesitant, who have not done it yet? Where have you found success in being able to convince people?
Yeah, it's such a good question. And I think it's really an answer that applies to so many other areas of health for us, that we unfortunately experienced health disparities prior to the pandemic. So we're going into a pandemic with populations who've already either been disadvantaged and or had difficulty accessing healthcare. So for us, we really have to go to where people are at and what will best meet their needs. And in our case, we try to get to as many neighborhoods as we possibly can. We try to get to a lot of our community partners, like our faith-based organizations and our nonprofits, who have been amazing solutions to trying to reach very hard to reach populations. And I think one of the most significant things that we brought in prior to the pandemic, and I think we were one of the first communities that brought this model in, is we actually have structured our department to include community health workers. And those individuals that we brought in from various neighborhoods, from various backgrounds, from all kinds of life experience and cultures, they help to bridge this lack of trust that we might have within certain populations and certain neighborhoods. They're really our liaison to the greater community. They have been absolutely amazing. We now have an entire team of community health workers. I wish we could multiply that number, by 100-fold. And I think one of the ways that we all could best serve the populations that we care about are really just understanding from them directly what are their barriers, what are their concerns. And we're always encouraging people to speak to someone they absolutely trust. Go to their doctor if they have questions. Go to their family members and encourage them to get vaccinated. So it's really through those networks, really at the most individual place of where someone's at, that we need to start and then build out our systems from there.
Sticking with you, Anna, New Hampshire is not offering incentives to get vaccinated. Some states are. Would those help, do you think, in Manchester?
It's a tough call, because we do offer incentives for other conditions where we've tried to do outreach and encourage people to come in and get tested or screened. I think in this case, this is a very different time where we've really never had to experience a pandemic before in this generation. And I think people are vaccine hesitant, are vaccine resistant, because this is so new and it's happened very, very quickly. And it's kind of new territory for us. I think, again, we go back to this basic, if you've got those questions or that uncertainty, to really try to get the facts. And we are here to answer any questions at any time for any members of our community. But at the same time, there's an entire network of healthcare providers out there and professionals who also are, right at your disposal. And I would encourage people to really utilize those experts for your answers.
How about you, Bobby? Do you think incentives would work? Would they help boost those vaccine numbers?
Adam, that is a great question. And we actually are using vaccine incentives in Nashua. And, as Anna talked about with the community health workers, we've had a team that's been out in the community, going to barbershops, going to churches. We've been meeting people in parks and offering the vaccination. So we're running 2 campaigns right now. Refer a Friend is one campaign that we're offering, as well as thanking people for being a part of the solution. And so we're offering $5 gift cards to Dunkin' Donuts for individuals if they get vaccinated, or if they bring a friend to be vaccinated. And as Anna mentioned earlier, these are public health tools that we've used in the past for our HIV efforts and other immunization outreach efforts. And so we've decided to employ those strategies with increasing the harder to reach population groups right now by offering these vaccine incentives. And so we're looking forward to continuing those efforts. We see that they have worked. We've heard some great stories, of individuals who have come to our vaccination clinics and have brought a friend and said, I can bring someone else. Not just because of the incentive, because some folks haven't even taken the incentives. It's just the idea that they can bring someone to get vaccinated because they're also looking out for the health and well-being of their their family, their friends, and their community overall.
And Bobby, you mentioned the COVID-19 vaccine equity program. I know the state's numbers have lagged a little bit, and they've cited the fact that, starting with the older populations, those tend to be less diverse. But I'm guessing that Nashua and Manchester are really, the ones providing the numbers, if you will. So how is that program going in terms of reaching those populations?
We continue to work with our community health workers to do the outreach into the communities, using our faith-based partners, our community-based organization partners to maintain the efforts that we have in the community. The clinics that we were offering at our churches and at the synagogues, those ended the first week in June. And so right now it's the boots on the ground, meeting people where they are, going into the community, into the neighborhoods, being invited into different events to offer the vaccine. And so we're using all types of strategies, and we're actually working with the community members themselves. So as we're invited in, we go in and we make sure we have the vaccine. And our community health workers have been doing a stellar job of making those connections and making sure that we can meet people where they are.
And Anna, I wanted to bring in one other issue that's been kind of a sidecar to the COVID-19 pandemic, and that's mental health. And we've seen those problems arising in really serious ways in Manchester in the last few days and weeks. How big of a problem right now are you seeing on the mental health front?
Well, and I think this is actually a national conversation as well. I mean, we are gravely concerned for the mental behavioral health of our residents, and especially our youngest residents, and certainly those individuals who've had to go through remote learning and families. You know, it's been a really trying year for everyone. We just don't know yet what the full impact of all of the changes that have occurred in society will have on the population moving forward. But we've prepared ourselves prior to the pandemic by bringing on mental behavioral health care into our organization and having that expertise in-house so we can start strategically planning moving forward. So it's something that we've actually been responding to just about every single day in some shape or form. And it could be just simple things like basic needs that families really are crying out for right now. And with our community health workers and our other staff, we're trying to problem solve with everyone on an individual level. And if it really starts to exacerbate someone's mental health, that's really where we work with our partners to make those linkages, because we want people to have that access to care when they need it most. And certainly this is something that I feel will be a big part of our future for possibly years ahead.
All right, Anna Thomas and Bobby Bagley, we thank you as always for your efforts there on the front lines of this crisis. And thanks for joining us on Close Up.
Thank you, Adam, for having us this morning.
Thank you so much.
All right.
Yes.